Welcome to Living Healthy Chicago. I'm Jane Manzuris. We want to kick off today's show with an important conversation about living healthy in the wake of COVID-19. So let's hear from Dr. Allison Arwady, the Commissioner of the Chicago Department of Public Health. It's so great to have you on Living Healthy Chicago because that is exactly what you aim to do every day.
Yep, that's right. That's the job of the Chicago Department of Public Health 24/7. So thanks for having me on.
Absolutely. We've been watching you on TV giving the latest updates on COVID-19 for many, many weeks now. What's it been like to try to educate the public while also trying to put everybody at ease?
Yeah, it's always a tricky balancing act because, of course, the most important thing is that people get the information they need to best protect themselves and the people that they live with. Together, sort of as a city, we understand that the decisions that each of us makes individually has impact on how this virus continues to spread.
But now that we can get out of the house, the biggest lesson that we can take with us is to wear our mask and wash our hands and stay socially distant.
I always like to also include in there that I want people to think about their own risk and the risk of the people who are in their bubble. In any gathering, there could be somebody who has COVID and just doesn't know it, because we know that there's transmission when people don't have symptoms yet. And so the reason we wear that cloth face covering, it's a little bit about protecting us, but it's more about protecting the other people who we're interacting with. But other than that, keeping that 6-foot distance as much as possible is the number one. If I had to choose one, staying home when you're sick, maybe that's up there with number one. And then with that, wearing the cloth face coverings, doing the hand hygiene, all of the things that we've been learning over the last few months.
If they're not the N95 mask, it's not going to keep the virus out, but you're saying that the woven cloth will eliminate droplets.
There's a big, big decrease in terms of what really comes out of your mouth when you're wearing one of those cloth face coverings. The N95s are the ones that have really a very tight seal around the mouth and the nose. And those are really designed for the highest risk medical type procedures. But if both parties are wearing that cloth face covering, the risk of infection goes way down.
If you've known someone that was positive with COVID-19 and they were sick, how long is that person contagious? And when can you feel comfortable being around them again?
We know that they basically continue to shed virus, usually sort of a few days. We've not really seen cases of shedding virus past 8 or 9 days. And so we use a 10-day cutoff. And we basically say from the time your symptoms started, you need to be at least 10 days out from that, but also the last 3 days of that need to be really relatively symptom free. And that's because people who may have more serious illness can have higher virus levels that could last longer. Once they've been 10 days with the last 3 days without symptoms, they're not at risk of shedding virus anymore or of transmitting. At that point, we just want people back to the same precautions. So still trying to keep the 6-foot distance, wear the face covering. We're still learning about what immunity really can look like after COVID infection. So I don't want people thinking, oh, I've had COVID, I'm fine. And if you look on the website, chicago.gov/coronavirus, we have a little bit more detailed information.
Let's talk about public transportation because so many of us need it to get to work.
So we've been working with the Chicago Transit Authority since like day one of coronavirus. So whether you look at the buses, where we've done everything from have increased cleaning to allow the backdoor boarding to thinking about how many people can be on a bus and what spacing can that look like. On an individual level, I would remind you that you want to try to keep that 6-foot distance. And so if a bus or a train is really looking too crowded, you should wait for the next one. Other than that, if you're on the bus, if you're touching things, as long as you wash your hands before you touch your eyes, nose, or mouth, again, remember the virus needs to get into your respiratory tract. There's not a significant risk of transmission just from being on the CTA. I would encourage people to really come back to public transit as they come back to their other activities. Again, keeping COVID in mind.
We are going to take a quick short break. Can you stick around? And when we come back, we'll continue the conversation.
Absolutely.
Hey, did you like that and you want more Living Healthy content? It's easy. Just check out these videos right here.